Okay, I'm now going to go over our admission forms and discuss the signalment of this patient. So, this was a new client. It was transferred from the emergency clinic. This is the new client sheet. It basically has all the client's information, phone number, address, best contact info. And this is the new patient sheet. It has the name of the patient, the breed, the sex of the patient, approximate age, short hair, long hair, any identifiable markings, and what color the patient is. And they fill all this out per patient.
You have all of their belongings up here.
Hold on, sorry. So this one here was transferred from the emergency clinic, had gotten attacked by a dog. So we have this medical history, medical problems. It has a hernia that we are going to be repairing today. So all this information is from the emergency clinic. It's a it's a Schnauzer, 9 years old, female. On this sheet here, it also discusses that our patient was in shock and in pain due to this injury. So we are going to be surgically repairing this today. And this is our check-in sheet that kind of goes over what we initially saw. The mucous membranes were pink and the color return rate was less than 2, so that was all good. Temp was 100.1 and our weight was 10.6. Okay, as far as permanent medical records, this is what we have, and this is from the emergency clinic. So this goes over everything that they did while the patient was in their care, so that we have something we can look at and compare and also continue the same treatment. It also includes the blood work that they ran while she was there and those levels, so that way we don't have to do it again. Now, our other patients' medical records, like if they've been here for a while, are stored in our computer, and everything that we've done is shown here. Okay, I'm now going to go over our release and consent forms. So this is our surgery release and consent form. Here we have the pre-anesthetic blood work section. It kind of goes over what we like to run. This is for the rescues and talking about the different vouchers and to bring them. This is our dental section. It kind of goes over extractions, and the owners can authorize extractions without a phone call, or they can say to please call before, or they can say perform do whatever dental work needs to be done at that time without a phone call. And then they have to sign electronically and give us the best phone number to reach them at, so that we can call them if we need to during and for sure after the procedure. Okay, these are our cage cards that go on the outside of every cage that our patients are in. They include the first and last name of the patient, the doctor, and which tech will be taking care of this patient. The red card indicates that this is a surgery patient. It's got the date, some pertinent or some important markings that this patient may have. So this is a gray cat. That way we ensure we get the proper patient for the procedure. It lists the procedure we are going to do and any additional things that need to be done. We also have a place for the patient's weight, and we write down the temperature and also what flea and tick preventative that this patient is on. We make sure that the card for this patient is clipped securely to this board and latched onto the cage when we put each patient in here. So this is an example of one of our laboratory forms that we complete for biopsies and cytologies. We don't actually have a physical form that we complete. It's all done in the computer. So basically, as we fill this out, the number of containers submitted we would report here. The container size, there's several different options. Total number of specimens, so if we got something from the liver and then something from the spleen, we would put 2 here if we had multiple. Whether or not we need a special stain here, if we had any pathologists, we requested the source from the biopsies and whether it was excisional, needle, incisional, or endoscopic. And whether or not we submitted all tissues. If there was a previous biopsy that we had done, we would list that number here. That way the pathologist could pull that up and see that easily. And then any pertinent history that this pathologist might need to perform and come up with a good diagnosis for us. Here is an example of one of our anesthesia forms. This is our anesthesia monitoring form. We perform it on every patient that gets surgery. We have several things that we fill out: the anesthetic risk, whether or not SIVO was used, the EKG, oxygen, surgery start time and end time, and which doctor and technician were in on the case. We also record what medication we use and the amount, whether or not surgery fluids were given, antibiotic injections, type of catheter placed, and where. And then every 5 minutes we record the patient's vitals. Okay, I'm now going to go over how we would typically discharge this neuter declaw. We did today. So we would instruct the owner to keep him calm. We'd keep him overnight at the hospital, and then the next morning he would go home with some pain medication and a little antibiotic. We would instruct to keep him calm, and if he was an outside cat, to keep him inside, at least until his bandages are removed and his declawing area has healed sufficiently. So our declaws are sent home on an antibiotic that we would instruct to start that morning, giving 1 tablet by mouth every 12 hours. They'd be sent home with some Medicam, which is for pain. Our instructions read, give 0.2 cc's by mouth once daily for 3 days, then give 0.1 cc's by mouth once daily until gone. We also would send home some yesterday's news, cat litter, and we would instruct her not to use regular clay litter and to only use the yesterday's news until the entire bag is gone. One issue that she would see if she used clay litter was that it would clump around the incision areas from the declaw procedure and could lead to infection and other issues as well. Cat neuters are typically fairly simple procedures. There's usually not any issues, but we would instruct her to look at the incision site and make sure that the patient is not licking or chewing back there. Normally they do just fine. We would definitely instruct her to be cautious when giving the Medicam because, cats are sensitive to NSAIDs, and this is a very short-term dose. And, amoxicillin typically has no issues or adverse effects. I'm now going to show how to properly restrain holding a patient for a jugular blood pool. Make sure the patient is sitting down. Then you want to put your arm over the patient, secure them to your body. Take hold of both front legs and lay the patient down. It's okay, Lily. It's okay. Then you're going to want to take your left hand, pull the head up, and secure the back of the head against your shoulder so that the patient cannot jerk back. That way the technician pulling the blood has a nice still patient and a clean view of the jugular vein. I'm now going to show how to properly restrain a patient for a cephalic vein blood pool. Again, make sure the patient is sitting. We're going to lay her down just a little. I'm going to secure her head so that she feels nice and secure, also so that she cannot bite the technician pulling the blood. And sometimes if they don't want to sit, even smaller dogs, you can pick them up, get them off the table. That way they're not able to jump or jerk around. Sometimes the technician will use a tourniquet. So they would place the tourniquet on this leg, and you would use your right hand to make sure that the patient cannot jerk her leg back. Sometimes the other technician would like you to just occlude the vein with your own hand. So you would just, in the top of the elbow, put some pressure to occlude that vein so that the technician can pull the blood without using a tourniquet. Okay? I'm now going to show how to properly restrain for a saphenous blood pool. You need to make sure the patient is laying in lateral recumbency with your right arm, put some pressure on the neck area, but not too much. You basically just want to apply light, firm pressure. You'll hold the down leg with your right arm, and then the up leg with your left hand, and then you will occlude the vein with your left hand as well. The technician pulling the blood will extend the leg, the down leg, in order to give them a nice clear shot of the saphenous vein. Okay, I'm now going to demonstrate how to properly remove a dog from their cage. We're going to unlock our secure latch. Lift up on our latch here. I'm going to lasso the patient so that she cannot jump. And while I'm in the cage, I'm going to get a secure hold of her, making sure I'm supporting her body and her front end. Okay? I'm now going to demonstrate how to properly place a patient back in the cage. I have a hold of the leash just for initial support and a good hold of the patient. I place the patient in the cage, remove the lead, and keep a hold of her so that she cannot jump out. And then make sure the door is properly latched, and I place the lock on the cage. I'm now going to demonstrate how to properly apply a muzzle. Oh, I know. So you're going to place this over the patient's face, assuring that the nose is not pressed up against the front. You want it to fit comfortably. You're going to adjust the latch so that it's snug but not too tight. And then you close the buckle or attach the buckle, and it's just like that. She doesn't like it, but okay, you did good. I'm now going to show how to properly apply an Elizabethan collar, if she'll let me. So you want to make sure that the patient's nose is not over the collar, because then they would still be able to reach their incision site. You want to come as far around as possible and latch it. This one has little plastic locks. You want it to be snug but not too snug. You want it to basically be able to move but not come up past the patient's ear. So this one fits good, that her nose is not past the border of the Elizabethan collar. And that's basically all you do. I'm now going to demonstrate how to obtain a temp, pulse, and respiration on a patient. This is Brody. We are going to first get a temperature. I'm going to use a rectal thermometer. I'm going to come over here and get a little bit of lube so it's not so harsh going in. Okay. All right, Brody. I know.
It's okay, buddy.
Normal temperature rate on a dog is 101.5 to 102.5. So we are going to see what his is. 98.2. It's a little subnormal, so I would definitely alert the doctor to that and let the doctor know. Oh, Brody. All right, I'm now going to look him over. Look at his eyes. Hey, it's okay. Look at his gums.
Brody.
Hey. Oh, he's trying to bite. His gums are good. His capillary refill time is less than 2, so that's good. I'm now going to listen to his heart and get his heart rate.
Hey.
So 22 times 4, that's 88. So that's a normal heart rate. And now we're going to do his respiratory rate. It's just probably high because he's a little nervous.
Can you redo it?
And that was 36. His lungs sounded clear. There were no crackles or anything. So I would assign him an ASA grade of 1, but definitely alert the doctor that his temp was a little subnormal. But overall, he seems fine. I'm now going to get a temp, pulse, and respiration on Wally here. I'm going to use this ear thermometer instead of a rectal. .6, so that's normal. Now going to attempt to get his pulse. He loves to purr, so we'll have to see if we can hear his heart over his purring. That was 30 times 4 is, pulse was 120. Heart sounded good. I didn't hear anything abnormal that would make me need to alert a doctor. I'm going to listen to his lungs, make sure they sound clear, and get his respiration rate. Okay. Okay, that was 36. His respiration rate is 36. Lungs sounded clear. I didn't hear any wheezing or any restricted airway sounds, so I would assign him an ASA grade of 1. Okay, I'm now going to do a jugular pull on this sedated patient. Make sure the syringe and needle is bubble up. I have occluded the vein. Okay, I am now going to do a cephalic blood pull on this dog. I've already placed my tourniquet. I'm going to feel for the vein. Place my thumb to kind of stabilize the vein. Okay. Okay, I am now going to pull blood from the saphenous vein in this patient. I've already placed my tourniquet and used my alcohol to prep the area. I'm going to stabilize the leg. And all right. Okay, I am now going to perform a jugular venipuncture on this cat. I have shaved the area and I'm going to spray it with some alcohol. I've got my needle and syringe. And we are going to get enough to run some blood work on this cat. And I'm going to make sure and apply enough pressure because that jugular vein is major blood flow. So I'm now going to perform a cephalic venipuncture on this cat. I've prepped the area and sprayed with alcohol to clean. I'm using a tuberculin needle. I'm now going to do a saphenous venipuncture on this cat. I'm spraying the area with alcohol, and my technician here is occluding the vein. Okay, I'm now going to go over the minimum databases that are required in our hospital. We run what we call a diagnostic profile on every animal that is going to be anesthetized. Our spay and neuters get less chemistries analyzed than any other procedure. So dentals, cystotomies, cruciate repairs, anything like that is going to get what we call a Chem 10. It includes glucose, BUN, creatinine, total protein, albumin, globulin, ALT, alkaline phos, the electrolytes, and globulin. I already said that, I think. Our IDEX machine runs this for us, and it includes the parameters that are considered normal. So for this patient, everything was within normal limits, so we would consider him a healthy surgical candidate. We also run a CBC on any animal that is anesthetized. That includes hematocrit, packed cell volume, white blood cell count, platelet count, and several different little things in that. And our IDEX Pro site does this for us and includes the normal measurements here and here. It kind of tells you your reference ranges. Now Brody, the white count was high, as you can see here, so that would cause us to be alarmed. However, Brody was getting a dental cleaning and his mouth is really infected, so that's more than likely the cause for the high white count. So when we're performing a physical exam on a geriatric sick or injured patient, we definitely always take a temperature right off the bat. If there's any labored breathing, or if we notice anything like mucous membranes are not a healthy color, if they're blue or cyanotic, we would definitely recommend have the doctor come in. More than likely, he would recommend an ECG and radiographs right off the bat. If he's suspecting heart issues in our geriatric patients. On our sick or injured patients, we definitely check the gum colors. If they're pale or look like they might be anemic or shocky, we definitely immediately need to pull blood, and we typically run a CBC first to kind of see where their blood count lies. We also check the platelet count. We would also do a chemistry count to see if any of his or her internal organs were damaged or affected. That's basically our go-to protocol for our sick and injured animals or geriatric patients that might be in distress. Now, when we are determining which anesthesia we use, we basically have two different forms. We either use the IM injectable conjugate the injectable cocktail of Dormitor, Torbital, and ketamine at 0.1 mil of each per 10 pounds, or we use Valium ketamine, and we determine when we do these on if anything is geriatric or might be high-risk anesthesia, like it was a hit by a car, or the kidneys or liver might not be functioning properly, or they're considered high risk. We always use Valium ketamine. Younger dogs, spays and neuters, cruciate repairs, some things that are more painful, we'll definitely use the Dorm, Torb, and ketamine because it seems to keep them down better. All of our anesthetized animals have an IV catheter in place so that we can administer Buprenex as needed for pain control. That's our go-to medication for pain control. So today in surgery we had spays and neuters. So for our spays we used the Dorm, Torb, and ketamine combo. They were all young, healthy dogs. All of their parameters were within normal range as far as blood work goes. But we did still place an IV catheter in each patient and administer fluids. They did not need any additional pain medication. We gave them an oral dose of Deramax when they first were brought into the facility. And we made sure these patients woke up good on their own and did not require any additional pain medications. Okay, I'm now going to log a controlled substance that we are prescribing. We are doing alprazolam, 0.25 milligram. So we start with the day's date. Today is November 1st. The client's name, the patient's name, the amount used, we're going to send 10, and then we need to subtract that from the balance on hand, which is 90. We need to make sure this is accurate because we do periodic counts of our controlled drugs, and they really need to match, or else we can get in a lot of trouble. Then we put our initials, whoever filled the prescription. We have our different tabs that separate the different drugs: phenobarb, tramadol, potassium bromide, Buprenex, Fatal Plus, and then alprazolam. And we do have it labeled here, our controlled drug log. We have to make sure this stays accurate, and we routinely count our drugs and make sure that these logs match. Okay, I'm now going to demonstrate the parts of our anesthetic machine right here. We have a rebreathing machine. We do not have a non-rebreathing machine, which is what you would typically use in any animal weighing less than 7 kilograms. It's easier for their body, it's easier for their body to handle because of the low gas resistance, but we do not have one. We definitely are going to invest in one very shortly. We just don't have one at this time. So I'm going to place you here. Well, actually first. So this is our induction chamber. We use this on any of our small pocket pets that we do surgery on, birds, rabbits, guinea pigs, hamsters, even really small kittens that need to be anesthetized with gas instead of injectable medications. We place them in this box. If they're really small, we have a divider here that we can place, and then we would just connect our hosing to the top of the box and anesthetize them with our sevoflurane gas. I'm gonna pause this. Okay, I think you can see me pretty good. So I'm going to show you the parts of our anesthesia machine. This is our oxygen flow meter. All we have to do here is turn the little knob. We have oxygen up in our attic, like a very large oxygen tank, and we rarely have to refill it. So we have hoses that come down from the ceiling, as you can see there, and they're connected to both of our anesthesia machines. We have 2 anesthesia machines here in surgery. So all we would have to do is spin this little dial, and it would turn on our oxygen. Then we come over here. We have our reservoir bag. We have several different sizes depending upon what size animal that we have. This is our vaporizer. We use sevoflurane here. This little window right here tells us how much sevoflurane is in here and whether we need to refill it. And we would just spin the dial and adjust the sevoflurane as needed per patient. This is our soda lime canister, our carbon dioxide absorber. We change this out very frequently. It's very important to keep this changed. It could cause severe problems, even death for the patient if this is not kept fresh. This is our pop-off valve, our pressure gauge here. And down here are our F-air canisters. Okay? Okay, I'm now going to demonstrate how to do a leak test on our anesthesia machine. I am going to close the pop-off valve here, and I'm going to occlude the end of this breathing hose with my palm. I'm going to turn on our oxygen supply and flush until I get a reading on the pressure gauge of 40. And then I'm going to make sure that the pressure is not dropping. And it is not dropping, it's actually raising. So that would mean we do not have a leak. Okay? So I'm now going to hook this patient up to all the monitors. And I'm also going to apply eye lube into this patient. It's very important to keep the eyes lubricated because they can get dried out and can cause ulcers and lots of other issues. So I just close the eyes to kind of distribute the eye lube. Now we're going to begin hooking our patient up to the monitor. This is our breathing monitor. It measures all the breaths. Every time the patient breathes, it beeps. That way we know the patient is breathing like she is supposed to. This is our thermometer. We feed this down. It's an esophageal thermometer. We need to be very careful not to puncture or force. We just need to feed it through carefully. And the temperature will begin reading on the screen down here. We will then hook up our SpO2 monitor here. The tongue is the preferred place. You can do the ear, you can even do the prepuce of the patient, but it's kind of, we prefer the tongue. This is our blood pressure cuff. I'm going to untangle it. It gets kind of tangled with all these wires. This side is to the patient. So we are going to attach this here. Okay. And our ECG leads to monitor the heart rate. As you can hear, the patient is breathing great. So we're going to smoke over fire. I'm going to spray the leads with alcohol. This is a very furry kitty. So we want to make sure that we are getting a good reading. Slowly but surely. Okay, great. This is how we hook our patients up. Every patient gets hooked up to all of these different things each surgery, and we monitor them every 5 minutes. Okay, this is Dr. Bogard. She is one of our preceptors and has been helping me and will be helping me with this surgery video.
And all the techs are laughing.
Oh, there. Good. I'm now going to demonstrate how to properly place an IV in the cephalic vein of this patient. We are going to place our tourniquet. I'm not going to tighten it yet. I'm going to prep this area first. I'm going to go ahead and shave a small area right above where the IV is. This is a long-haired dog, so I'm going to just kind of clip the hair in the back so that it doesn't get stuck to my tape. Okay? All right. I'm going to tighten this. And I'm going to begin scrubbing. We need to do this 3 times. Using Corhex scrub and then following up with alcohol. This will ensure that our IV catheter does not get infected. This is especially important if you're leaving these in for a couple days. This one is just here for surgery, so we'll take it out at the end of the day. One more time.
So did we do a blue studies and check and see what box it is after we get it?
Okay, now I'm going to place the IV.
Okay, and we got it on 5% in the IV going, correct?
We received a flash, so we're going to feed the catheter through. I'm going to put the cap in the vein, in the catheter, and then I'm going to secure it with tape. I'm gonna, take this off real quick so I can tape better because the tape gets stuck to my gloves.
Yes.
Alright. I have securely ensured that this catheter is secure, taped accordingly, and I'm now going to put our cap in. And then I'm going to flush this IV to make sure that it is patent. Definitely is important that we have a patent IV during any surgical procedure. So I have my flush. It is just saline. I will place this in, inject a little bit. We need to make sure it's not blowing around the vein, and it's not. So this is a patent IV. But you also need to make sure that your tape covers the catheter completely. That way no bacteria or anything can get in. Okay, so I'm now going to place a temporary bandage over this IV catheter that I placed earlier. We are going to make sure that the port is open and able to be accessed if needed, and we are just going to bandage the rest of the area and make sure it is secure. Okay. Okay, I'm now going to place an IV in the saphenous vein. I'm going to first, I've already clipped the hair away from the site. I'm going to scrub it with Chlorhex and alcohol to make sure it's nice and clean 3 times. Just getting any bacteria and dirt away from the area because we're going to be entering the bloodstream with this IV catheter, and it's very important that this is clean. Okay. I've got the tourniquet placed, and I'm now going to place the IV catheter. This is a 22. Going to cap it, and then I'm going to tape it. It's kind of hard to tape with gloves, but you need to make sure that the catheter is secure. We do not want it moving or coming out of the vein, so it's very important that you secure the catheter.
There's a few, but there's like a wide array. Yeah.
You want to make sure that you tape over the portion where the catheter enters the skin or the vein so that no bacteria can get in that. I'm now going to put in my plug so that I can flush this and to make sure that it is a good catheter and it is in correctly. Okay, I've got my plug in. I'm going to hook up the fluids. And unlock all of the areas. It is dripping. So it is going, and we are making sure that nothing is blowing and it is in place correctly. Okay, I'm going to give some injections to this patient. This is some penicillin. I'm going to give this sub-Q. So I'm going to make a tent, go in, I'm going to draw back and inject. Okay? Now going to give an IM injection. I'm going to ensure I'm not hitting the femoral artery or the femoral vein. The nerve. Go in here, pull back. Okay. I'm going to give an IV injection. I'm going to place this tourniquet, spray with some alcohol. I am now going to sedate this dog for surgery. We use 3 different drugs. We use dextromethorphan, butorphanate or Torbital, and ketamine. We do a dose of 0.1 milliliters per 10 pounds. This dog is 13 pounds, so we always round up, especially if it's a spay, which this one is a spay. So I've done 0.2 of each drug. I'm now going to administer this IM. Cass here is going to hold If you pan over and show Dr. Stocks in the background, we do have a veterinarian handy and close. I'm going to give this IM in her back leg muscle. Oh, it's okay. We're going to make sure we don't hit any nerves or anything back here. Oh, hey.
She's deaf.
Pull back on the syringe. Make sure you're not in a vein.
Okay,
Okay.
okay.
So I'm now going to hook this patient up to all the monitors. And I'm also going to apply eye lube into this patient. It's very important to keep the eyes lubricated because they can get dried out and can cause ulcers and lots of other issues. So I just close the eyes to kind of distribute the eye lube. I'm now going to apply this endotracheal tube into the surgical patient here. I've got some sterile lube. I'm going to lubricate the end and throw that away. We are using a size 3. Most cats, you'll use a size 3. Bigger cats can sometimes take a size 3.5. But you just need to make sure when you're selecting your trach tube size that it does not rub the trachea as it goes down because that can cause some severe irritation. You can also size the tube according to their nose in between their nostrils, but most cats you typically always will go with a size 3. I'm going to lower the bottom jaw here. Okay. And now secure the tube with this tie. And carefully I'm going to lay the patient on its side and inflate the cuff. Taking great care not to overinflate the cuff. If you overinflate the cuff, it could burst and damage the trachea. So we put a small amount. You want to inflate it, but enough where you can squeeze it and it's not too firm. So that would be inflated. Now we will hook the patient up to oxygen and begin the procedure. Okay, so before you bring a patient into surgery or prep the animal for surgery, you should feel for the bladder to see if it needs to be expressed, because you do not want the patient urinating during the surgical procedure because that will break sterility. So we are going to palpate the abdomen gently but firmly and see if we can't feel this patient's bladder. Now we usually walk hours before surgery and I'm not feeling a bladder. If this one was full, you would firmly press on the bladder to express any urine that this patient might have. But this patient does not, so we are going to start the prepping process. Okay, I'm going to now clip this patient, clip the hair away from the surgical site. We are performing a spay, so it's very important to make sure all of the hair is away. In a big area. Our doctor does not like any hair in any surgical plane. And you want to ensure that along the area that the patient will be cut, that there is no hair left, and there is not. So we are complete. I'm going to get all the hair off this area and then we will scrub. Okay, I'm now going to scrub this patient for its procedure. We use betadine scrub and follow up with alcohol. We need to do this 3 times and we are outside of the OR. We start in the middle and work our way out. So I'm going to make my way out of the surgical plane. Okay. And I'm following up with alcohol. Doing it again. Making sure you do not go back over an area you have already scrubbed. Last step with alcohol. Then we do our final with betadine solution. Okay, we're now going to transport this patient to the OR.
It's going.
Okay, so we are now going to move our surgery patient from the gurney here to our surgery table. We've maintained sterility. We need to make sure that the area I've scrubbed does not touch anything during this process. So we are going to move him over, her over, and we are going to secure the patient in the correct operating position. That needs to be again, making sure nothing is touching that area. We want it to stay disinfected. Okay, and now we are going to go get our gloves, our gowns, and our caps on and hook this patient up and prepare for surgery.
Stop.
We basically monitor our surgical patients every 5 minutes and record this as we go. We also write down or record our anesthesia, the volume used, when the surgery started, when it ended, and all these parameters need to be filled out on every procedure. Okay. Okay, so we are in a dog stay right now. Dr. Bogart is staying our patient and I'm monitoring. So we monitor every 5 minutes and record this on our computer here. So I'm going to look at the temp. We are 100.9. I'm going to record that there. I'm going to do our pulse, 73. Our respiratory rate is at 30. Our SpO2 is at 97. And our blood pressure is at 114/89. And if you could just pan to that real fast. Okay. Okay, I'm going to demonstrate how you would administer CPR to a patient that was in cardiac arrest. The first thing you would need to do upon finding a patient in cardiac arrest is begin chest compressions. For a big animal like this, you would place one hand over the top of your other hand, place directly on the chest, and begin doing chest compressions in uninterrupted cycles of 2 minutes. You would then continue that the entire time and hopefully have a assistant come over. If the patient was not intubated, he would need to be intubated. You would make sure that his airway was not obstructed, and you would, there's 2 different routes you could go from here. We hook ours up to oxygen via our anesthetic machine. So we would connect them with this here and here, and we would use our reservoir bag, which I will grab, oh, and this fell, to breathe for the patient. So we would fill this up with oxygen, and the other technician would breathe at 10 breaths per minute for the patient. We would continue to do that, continue chest compressions until the doctor either told us to stop or if we started to notice signs of life at that point. Okay, I'm going to scrub in for surgery right now. I'm going to first do a pre-wash. I'm just going to wash my hands with some of this soap here. Make sure they're clean. I'm going to use this scrub that we have. And I'm going to open it. Okay. I'm going to use this pick to get underneath my nails first. Anything, any debris or anything I see, I need to make sure my nails are good and clean. Okay. I'm now going to scrub my fingernails on my left hand 10 times. Okay, and I'm going to start on my index finger the lateral aspect, and I'm going to scrub each side of my fingers 10 times. I'm going to move to the end of my hand, and I'm going to scrub down the palm of my hand to my wrist. Move to the palm of my hand in circular motion. And then get my thumb, including the side of my hand here. You want to make sure you're getting your webbing in between your fingers as well. Now I'm going to move up my arm 10 times on each side to my elbow. Okay, now I'm going to do the exact same thing on my right hand. Make sure my phone is still recording. Okay, because it will stop.
3.
Okay, now I'm going to rinse my hands, beginning at the fingertips down to my elbows. And I'm going to wash my arm again. Makes me pretty cough. I'm going to do the same thing with my right hand. Okay. Now going to come over here and get my sterile my sterile towel. I've already opened it earlier and I'm careful not to touch anything. So, I'm drying off my hands, not touching my scrubs. Making sure my fingers are dry. Okay, so I'm now going to organize the surgery field for Dr. Kimbrough here so he can begin his surgery. I'm going to open this. So we have our gauze. I'm going to lay the gauze out. Open up his instruments here. Got our drape and our towel. Go ahead and drape the patient. Do you want a towel clamp or?
Yes, ma'am.
How would you like it? Okay. My assistant is going to open up the suture, and I'm going to get the needle holder to get the blade, and then I'm going to place the blade on the scalpel handle using the needle holder. Okay. All right. We are ready to begin. Dr. Kimbrough will tell me when he wants me to hand him an instrument.
Okay, hand me the scalpel. If you'll block for me. Hand me a hemostat, please.
Sorry. Okay, that's good. Okay, so the duties and responsibilities of a sterile technician in surgery, their responsibilities are to be there for the doctor to assist with anything the doctor may need. It is definitely their responsibility to maintain sterility, not to touch anything that is unsterile. Do not touch your gowns. Ensure that your gloved hands are above your waist. Never let them drop below. And just don't touch any of the surgical site that is not sterile. If anyone does break sterility, like if your gloves get torn or ripped or poked, you need to have these non-sterile technician who should be in there assisting you to bring you a pair of sterile gloves, and you need to put those new sterile gloves on in the most sterile fashion that you can, and then you will be okay to continue helping in surgery. If an instrument is dropped or anything, you need to have your non-sterile technician bring you a mixture of Chlorhex and water in an instrument tray. The non-sterile technician will pick up that instrument and place it in the sterile tray, the Chlorhex solution, and the instrument needs to sit for 5 minutes. After 5 minutes, it should be sterile enough to be used again in surgery. So yeah, basically, if you're scrubbed up in surgery, your responsibility is to be there for that doctor. If that doctor needs you to blot the blot the blood, pick up any extra tissue that might be around the surgical site that's getting in his way, you need to be there to do that. Meanwhile, maintaining complete sterility. Okay, so I am in here on this canine stay as Dr. Redgard does the procedure. I'm here to monitor the patient and make sure the patient's breathing, and if there's any emergencies or issues that arise, I'm also here in case she needs anything. So that is basically my duties as a surgical tech. Okay, so I'm now in here assisting with a feline neuter. These are pretty simple procedures. The doctor usually doesn't need much help, but I am holding the patient still for her while she performs this castration.
2, 3.
This is also one of my AVMA required surgeries. So this is a canine neuter that we are doing, and I'm actually completely scrubbed in and helping assist with this.
Hand me the.
Okay, this is one of my AVMA required surgeries that I'm sitting in on. This is a feline stay. I'm not scrubbed in, so I'm just here to monitor the patient and make sure the patient is breathing and her vitals are all within normal range. Okay, so when you're cleaning up the surgical suite, you want to make sure you focus on the table. So I'm going to roll up our heating pad here, place it off to the side. You want to spray the table down with a disinfecting agent. You would wipe it down really good. You make sure to get all the debris, all the blood, anything off of it. You also need to open the table and clean out the catch tray down below. Okay? So this here, you just want to remove it. This tray right here, you want to remove it and clean all of the debris out from inside here. You want to make sure all of your leads and your equipment you are using to monitor is wiped down with alcohol and cleaned, and any blood or anything is cleaned off of that, and you want to make sure it's put back correctly. Any sharps, needles or blades need to be disposed of in here. Then you want to make sure your anesthesia machine is put up correctly. You want to check the SIBO level. You want to check the date of your soda lime canister or your soda lime granules and your F-air canisters down here and the amount of time that your anesthesia machine was in use. We monitor it by every 15 minutes and we put a check. So when that's full, we need to change our F-air canisters and our soda lime. You just want to make sure everything you've used is put back in place. You want to check the lights, make sure there's no bloody handprints on them or anything, and just make sure the place is stocked and fully put back in order. Okay, I'm now going to demonstrate how we clean our surgical instruments. I've prepared a sink full of instrument cleaner here and warm water. My instruments have been soaking after surgery, and I'm about to manually scrub them with a soft brush carefully. But I'm going to make sure that there's no debris left over. I'm going to clean every surface of the instruments. So I'm going to do that and begin now. I'm just taking care to make sure the instruments are all open. None are locked. You don't want them locked during the cleaning process or the sterilization process because that can damage them. So I'm just cleaning them now. It is important to be careful with these instruments, but you do want to make sure that they are clean. If there are a little leftover debris, the ultrasonic cleaner also takes care of that. Okay, so our ultrasonic cleaner has already got a mixed ratio of water and instrument cleaner. So we place our instruments in there. Let me try my hands and I'll show you. Okay, so there's our ultrasonic cleaner. I'm going to shut the lid. We're going to turn it on for 10 minutes. Can you see? Oh, yep, okay. Once this is done, we then place it in our instrument lube. Then I will rinse them, which there's our instrument lube. Then I will rinse them with distilled water and place them in our tray right here to dry. Okay, I'm now going to demonstrate how to fold a surgery pack. I've got my towel here, folded accordion style, so I'm going to lay this down right here. I am then going to put my spay hook, scalpel blade handle, my thumb forceps down. And I'm then going to lay down my set of instruments. They're all unlocked and held together by this towel clamp here. So we lay these flat. I've got my pack of gauze with 2 sterile needles attached. I'm going to lay those down and then cover this with my drape. This is a medium pack, so it has a medium-sized drape inside. I'm going to lay my sterile autoclave indicator strip on top. Once this is autoclaved, this will actually turn dark. That way we know it's been properly autoclaved and the instruments are sterile. All right. So we are going to begin the wrapping process. Hopefully you can see. I'm going to bring this up and fold it. Bring it up again over the pack here. Then I'm going to bring this other end and fold it once, and then bring it on top of the pack as well, giving it a nice pull so it's good and snug. And then going to bring out up one end here. Again, we want to make sure this is good and snug so the instruments stay put and we can fit the most instruments into our autoclave. I've got just regular masking tape here. I make a tab with the tape so that it's easy to pull off. And then we have our autoclave tape here that will change colors once this pack has been steam sterilized. I just put that there. I will then address this with my initials, today's date, and the type of pack that this is. So this is just a medium, so we'll write an M for medium, okay? Okay, I'm now going to demonstrate how to fold a surgical gown for sterilization. I'm going to lay these arms flat here. Make sure they're flattened out. I'm then going to bring one side up and over the arm. And do that to the other side. Okay, and then going to bring this other side over. And over. Make sure it's good and flattened. Hopefully you can see. Okay. Then I'm going to begin folding it accordion style, starting here at the bottom. Okay. Just like this. Now we're going to go wrap this gown. Okay, I'm now going to demonstrate how to wrap this surgical gown that I just folded. Here's my gown. Here's a towel, folded accordion style. So we are going to fold this end here and make a triangle. I'm then going to come up with the right side, fold it over, and then bring an edge back. Okay? I'm then going to bring this left side over and bring a small portion back. Then I'm going to bring the top down and tuck it up under here so that there's a little tab left over that we can pull up to open. Then I'm going to tape it with my autoclave tape and my masking tape to label what it is. I'll label it with today's date, my initials, and what this is. All right. Okay, so to load our autoclave, we actually have a tray here. The tray can be taken out and moved accordingly depending on what type of packs you use and how many you have. We can fit several packs in this machine. Right now I'm just going to demonstrate the one that I just closed up for us. So we want to slide this into the back. Okay, so if we had more packs we could stick some up above and fill up this tray. Before we autoclave the packs we need to check the water level it is in the green, so we are good. If we needed to refill it, we would get distilled water and pour it into this little chamber here. So we are going to close our autoclave. We just shut this door, push this down, and it's going to latch. We have several options here. Pouches are for our clear windowed packs, and then our packs are our actual wrapped instruments. So we are going to select pack. It heats this machine. The autoclave heats it up to 250 degrees Fahrenheit for 30 minutes and fast dries for 30 minutes. And once it's gone through its sterilization process, this will actually unlatch itself to vent and to cool off. So we would select packs. We would then select start. And it begins filling the chamber with that distilled water and heating it up to the temperature specified by the selection that we made of packs. So the maintenance that this machine right here requires is we need to keep up with the water level, make sure it stays within the green little area that I showed you before. And then once a month we need to perform a maintenance clean on this machine and drain all the old water out and replace it all with fresh water. And that needs to be done once a month to make sure our autoclave is working properly and up to the standards that it needs to. So a way that we ensure that our packs are sterile is this autoclave tape here that we use to wrap every one of our packs will turn, the little hashes here will turn black. And they all need to be this deep black color. Any fading black or anything like that would kind of cause some alarm because we would think that it's possibly not as sterile as it needs to be. So this deep color, you need to see when you remove the packs from the autoclave. And also when we open our packs, we have indicator strips inside each pack, and those need to be, the color of those need to have changed, and that way we know that the inside of those packs had reached the temperature that it is supposed to be sterile. Okay, I'm now going to perform a suture removal on this patient here. When you perform a suture removal, you want to make sure that the tissues have healed well. You want to make sure they're together, it's clean. You want to make sure there's no swelling or drainage or any redness. If so, if you notice that when you are about to perform your suture removal, you need to get the doctor and have the doctor check it before you pull any sutures. So I'm now going to take this out.